There are millions of people on furlough, as the Prime Minister knows, millions with children at home struggling with caring responsibilities. If they're to return to work, and if their children are to return to school, they need reassurance. I think we can all feel that, reassurance that it'll be safe to do so. And that means they do need to know what the government's plan is for the next stage. So will the Prime Minister give them that reassurance by setting out his plan as he says he will? Or will he come to this House on Monday to present that plan and have questions across the House?
Mr. Speaker, I will of course undertake that there will be a statement to the House as you, Mr. Speaker, and the House would properly expect about what we propose tonight. So I just want to explain to the House as a courtesy why it's happening on Sunday, Mr. Speaker. I'm sure you'd be interested to know that. The reason for that is very simple, that we have to be sure that the data is going to support our ability to do this. But that data is coming in continuously over the next few days. We'll want, if we possibly can, to get going with some of these measures on Monday. I think it would be a good thing, Mr. Speaker, if people had an idea of what's coming the following day. That's why I think Sunday, the weekend, is the best time to do it. But of course, the House will be fully informed and the House will have the full opportunity to debate.
But yesterday we learnt, tragically, that at least 29,427 people in the UK have now lost their lives to this dreadful virus. That's now the highest number in Europe. It's the second highest in the world. That's not success or apparent success. So can the Prime Minister tell us how on earth did it come to this?
Prime Minister. Mr. Speaker, first of all, of course, every death is a tragedy, and he's right to draw attention to the appalling statistics, not just in this country, but of course around the world. And I think I would echo really in answer to his question what we've heard from Professor David Spiegelhalter and others, that at this stage, I don't think that international comparisons and the data is yet there to draw the conclusions that we want.
And I want to go to yesterday's figures that show that whilst happily in hospitals it looks as though deaths are falling, deaths in care homes continue to go up.
Well, actually, Mr. Speaker, I mean, he's quite right, of course, to look at the crisis in care homes, and he's absolutely right to say that there's an epidemic going on in care homes, which is something I bitterly regret, and we've been working very hard for weeks to get it down, and a huge amount of effort has been gone into by literally tens of thousands of people to get the right PPE to care homes, to encourage workers in care homes to understand what is needed. And I can tell him actually that he's not right in what he just said about the state of the epidemic in care homes. As he looks at the figures, in the last few days there has been a palpable improvement. We must hope that continues, and we will ensure that it does continue.